June is National Migraine and Headache Awareness Month. About 10% of people around the world live with migraines, and if you've ever had one, you know that they can be absolutely debilitating. But how do you get the right care and keep it from derailing your life? Joining us live this morning to discuss all of that is neurologist Dr. Liang Wang. Good morning. Thanks for joining us.
Good morning, Mark. Thanks for having me.
So maybe first off, what is the difference between maybe just a bad headache and then a migraine?
Well, like you said, Mark, a bad headache, I think all of us have had a bad headache in our lives. We reach for something over the counter and we carry about our daily life. A migraine, on the other hand, is like you just said, it's debilitating. It is absolutely wipes you out. And for people who have suffered from migraines and have had migraine attacks, they can tell you they just cannot function and it causes disability. And in fact, it's one of the leading causes of disability all across the world and one of the most common neurologic conditions. And probably it causes more disability than all other neurologic conditions combined. And it's not just the pain that people experience with migraines, which is excruciating, but it's also other associated symptoms such as dizziness, nausea that can cause vomiting sometimes. People have difficulty processing information. They can experience extreme fatigue. There are other associated what we call migraine auras. People who have migraine auras, for example, can have difficulty speaking or processing information. And that all together, combined with other features of migraines like sensitivity to light or sound, it just results in completely wiping your day out and you just can't function.
The American Migraine Foundation says fewer than 5% of people with migraines have done all of these things, been seen by a healthcare professional, been diagnosed, and received the right care. Why is that number so low?
Well, part of it is that first, migraines affect everyone in all walks of life in different ways. Some people experience headaches maybe on one side versus the other. Migraine attacks don't have to necessarily even affect the same person the same way every time. So recognizing what is a migraine can be different. Sometimes people can have a migraine aura like numbness and weakness without ever experiencing even the headache. And people from all walks of life, like I mentioned, can have a headache. School-age children up until the age of 70s, 80s can have a migraine. So one is recognizing what is a migraine and when they have a migraine attack. Two is understanding what are the treatment options available. Especially in the last 10 years, we've had breakthroughs in discovery about the science behind migraines and as well as the treatment. So there are new treatment options available. And for many people who have migraine attacks, sometimes they just feel like it's hopeless because there are no effective treatments. But I think that especially in recent years with new medications available, there are effective treatments, and being diagnosed properly, being educated about when to take medications and how to take them can really affect the quality of how effective the medications can be and really preventing disability.
And those medications and the treatment, are there any that are considered a long-term fix?
Yes. So most people have what we call episodic migraines, meaning they get one episode, maybe one or two attacks a month. And then there are so we call those medications that we give for them migraine stoppers. So as soon as you feel the onset of a headache, it may not even be the headache itself. Some people can feel a migraine coming because of the fatigue, the sensitivity to light or sound. You take a migraine stopper and it'll prevent the headache from even starting. Or by the time maybe they can reach for a migraine medication, they have the headache already, will prevent the headache from continuing on. A smaller percentage of patients will have what we call chronic migraines, meaning they have debilitating attacks at least 14 or 15 days out of the month. And you can imagine that's quite a lot. So for those patients, we actually recommend a daily medication to take. And they may not even be pills. The newest medications are injections even that you can just give yourself a shot in the belly like insulin, and they can help decrease both the severity and how often the migraine attacks hit you.
Before we let you go, is there a stigma around migraines? And if so, why does that exist?
So there definitely is a stigma, and it's because of the disability that migraines cause. because people miss out on life. They cannot work, they cannot go to school, they need an excuse, so quote unquote. And so people who, if you've never experienced a migraine and people miss out on work and school, they may attribute that to just unable to bear stress or trying to find a medical condition to avoid going to work or school, when really that's just not true. And that's where the stigma comes from, is missing out on life.
Okay, well, you provided some excellent insight and awareness here. We appreciate it. Dr. Liang Wang joining us this morning. Thank you again.
Thank you.